In this video, I'm going to go over some techniques you can do if you can't lie down either on your stomach or on your back, and you're having back pain and you want to reduce your back pain and improve your mobility. Our first technique is just going to be a seated knee to chest stretch. What you're going to do is pull on the knee, pull this back as far as you can, holding this for 10 to 30 seconds, and then repeat that on the other side, holding that for 10 to 30 seconds. A lot of times we get a lot of increased tension in the backs of our legs, the backs of our thighs, going in our buttock area. That can just increase the tension, most especially if you're having back pains. Just working on kind of stretching out that tissue does really well at taking some of that pressure off of the back and just allowing you to mobilize and move around a little bit easier. This stretch you can perform in the long sitting position or just seated as we were in the previous stretch. That's fine. You're going to take a towel or a stretch strap, put it around the ball of the foot, pull back on the foot so that the toes come back in what's called dorsiflexion. You're going to feel that stretch on the back side of the calf there. You're going to feel that in the back of the hamstring. As you pull a little harder and you pull the entire lower extremity up off of the surface that you're sitting on, you're going to feel even more of a stretch. You're going to hold that somewhere between 10 to 30 seconds and repeat that several times a day. And I also repeat that on the opposite leg as well. This stretch will be performed in standing. You're going to go to the back of a chair or another stable surface, a countertop, or maybe the back of a couch. And you're going to just kind of lean back. And as you lean back, you're going to feel that stretch all through the middle and lower back area. I'm just going to stretch leaning back, holding that between 15 to 30 seconds. Repeat that several times a day. Our first movement exercise we're going to perform is going to be a standing trunk extension. Now I like to start off with this either holding on the back of a chair or just a stable surface. And what you're going to do is you're going to hold on and lean back as far as you can, creating an increased curvature in the low back and the lumbar spine, leaning back. So if I'm standing to the side, I'm just leaning back like this as far as you can. Repeat that for 10 to 20 repetitions for 2 to 3 sets. I like to have my patients perform that several times a day. So you may do that 4 or 5 times a day. And also a point with that is if it's too painful for you to lean back very far, just go back a little bit and then work into more extension over time. You don't have to go all the way back really far the first time that you do it. Just kind of work through that and progressively get to where you can lean more into extension. The next movement is going to be a seated cat-cow. Now again, a lot of times people do this in the quadruped position, but for our purposes of the video, we're assuming that the patient, or if you're watching this maybe yourself, you're not able to get into that position. So this is a much easier position to get into. So you're going to start seated in a chair. And what you're going to do is round your shoulders over, kind of hunch around. That's going to be the cat position. And then you're going to go back, kind of poke your chest out, bring your shoulders back, really increase that curve in the low back, and that's going to be the cow position. So you're just going to repeat that back and forth from cat to cow. Repeat that for 2 to 3 sets, 10 to 15 repetitions, 4 to 5 times a day. Next is a standing trunk extension using a band. You can use all types of bands. I'll put a link in the description for a set of bands that you can purchase. So what you're going to do is you're going to step on the band. You can step on it with both feet. You can step on it with one foot, just whatever you have as far as what your band will allow. And what I'm going to do is I'm going to lean forwards a little bit here, right? Keeping my knees pretty straight, and then I'm going to stand back up. When I come up, I'm really kind of creating that low back or that lumbar curve, kind of that sway of my low back, and come back down. I'm going to come back up, repeat that for 2 to 3 sets of 10 to 15 repetitions. And that's just a great way to add some resistance to the exercise. You of course can add dumbbells and kettlebells and all that, but just initially using a light resistance band works really well to start loading that tissue. And then for our last exercise, this is going to be a standing hip extension. You can do this with a cuff weight, fastened around the lower leg. You can also use one of the bands, resistance bands, fasten that around the lower leg as well. Initially, just start without any resistance. You're going to hold on to a stable surface and work on kicking your leg straight back. Just kind of going back into that extension, focusing on keeping your knees straight the entire time. Repeat that on both sides for 2 to 3 sets, 10 to 15 repetitions, and perform that 4 to 5 times a day. Thank you so much for watching. I hope this video helps with your low back pain. Be sure to hit that subscribe button so you can stay up to date on all my content.